Welcome to your program of choice, Health Affair on AIT, a platform where we focus on public health issues, challenges of women and children with a view to providing lasting solutions. I am your regular anchor, Ushuomowa Daniels. Our focus today is on community pharmacists and their role in healthcare delivery. Please stay tuned. We'll be right back after the news segment.
One of Nigeria's foremost private multi-specialist hospital, St. Nicholas, has opened a branch in Surulere area of Lagos State, southwest Nigeria. Speaking with newsmen about the expansion drive on Friday, 3rd of November 2023, the management of the hospital said it became necessary to serve Nigerians better.
Originally, when St. Nicholas started off, we only had this location, which is at 57 Campbell Street. But since Dr. Maja Kodumi took over, we have expanded. And we now have altogether 5 branches. So not only do we have here at Campbell Street, we also have the St. Nicholas Hospital Clinic at Victoria Island. We have St. Nicholas Hospital at Maryland. We have St. Nicholas Industrial Clinic at Lekki Free Trade Zone. And quite recently, we have now opened St. Nicholas Hospital in Surulere. The hospital in Surulere is located at the junction of James Robertson and Akerele Streets in Surulere.
We're bringing Surulere, our Surulere branch, to you live to let everyone know in that environment that the service that we render, of course, quality service that we render, we're bringing it to the neighborhood so that everyone can benefit from the good work that we're doing here.
200 residents of Surulere are expected to get free medical care for the next few weeks as part of the hospital's corporate social responsibility.
There will be free consultation for people, the first 200 people that come in every weekend. We'll have things like their BP check done. We'll do their glucose to know the blood sugar level. There'll be free drugs too, because you wouldn't expect that we'll find someone that is hypertensive and then we'll let the person go away just like that. So there'll be free drugs too. And then if there's need for follow-up, there'll be that possibility, that venue opened up for the person too. So they should come expecting a lot. Things that you probably will say hypertension is a silent killer. Most people are just walking around, they don't even know what their numbers are really. So you get a first-hand information about how well you're doing in terms of your health, and then we'll take it up from there.
Established about 55 years ago by Dr. Maja Kodumi, a former Minister of Health, St. Nicholas Hospital has pioneered a lot of innovations in the nation's health sector, such as in vitro fertilization conception in the early 80s and kidney transplant in the West African sub-region.
Maja Kodumi, as you might be aware, happened to have been himself a medical doctor, and he was privileged to have trained both as a pediatrician and as a gynecologist, and was also fortunate to have been one of the very first ministers of our Federal Republic at the onset of the existence of Nigeria in 1960. So as it turns out, he was the Minister for Health, and a lot of what exists now are from the foresight of that very great man. But one of the very first to have an intensive care unit in the private setup. You might not be aware, but the very first conception by in vitro fertilization, by the gift technique, was actually conceived within this hospital. And that was in the late 70s, early 80s. Of course, we also pioneered kidney transplants in the whole of the West African sub-region. And we generally try to focus on a lot of things that we feel are required to enhance the quality of healthcare delivery in our country today. More recently as well, aside from focusing on quality, And you might be aware that we're now internationally certified. We're one of the very few hospitals in Nigeria today that has the international certification by COSASA. COSASA is one of the international quality and safety assessment agencies, and we're one of the very few hospitals that have achieved that certification.
To help cushion the effect of inadequate manpower resources amidst worsening brain drain, the hospital is also helping to train personnel in different specialties of medicine.
The Minister of State for Health, Tunji Alausa, was in Lagos lately for a working visit to some health institutions to ascertain the situation of things in the health sector, with a view to making improvement where necessary. Among the health institutions visited are the Nigerian Institute of Medical Research, NIMA, National Orthopedic Hospital, Igbobi.
Reviewing all the agencies under my purview, and this is the next part of the agenda, to come in and see what our research centers and agencies are doing. So my visit here today is to meet with the staff, hear them out, see what they're doing, listen to what they're doing and what their challenges are, and how we can better support them to begin to do much better to support our care system. But a huge part of it is increasing our human resource for health. They talked about funding. Everybody's heard the President Bola Ahmed Tinubu, his emphasis on improving, revitalizing our healthcare system, and his commitment is unshaken. This is big to him. Look at what we have in Lagos State today. It was his own effort 23 years ago or 24 years ago, and that became sustainable to what we have today. And this is what this president wants to do for our country, the entire country of Nigeria. At the end of his administration, we will have a sustainable health care that delivers the best care to our people.
Happy, fantastic. If you have somebody who is close, was your former board chairman, that knows your challenges, that is up there, has now come down to your place to listen to you, you'll be happy. And because we have trust that many of those things that we have asked him, he will deliver. So, happy.
The two honorable ministers that we have now have lived and worked in the US, where research and innovation is taken very seriously. And they have also been part of research in that country. So I imagine that they will be coming with a lot of experience, which they will bring to bear on research and development in Nigeria.
The 2023 Physicians Week in Lagos recorded a series of activities such as free medical intervention for residents, a briefing conference on salient issues affecting medical doctors, and a scientific conference where speakers called for insurance for medical doctors and their families, the need to implement the Abuja Declaration of 15% allocation to the health budget, and lots more.
It is only a week in Nigeria that we physicians celebrate ourselves, 1 week in a year. And I think it's important we should celebrate our wins, our gains, even our friends that we've lost, celebrate them, because we lost few of our friends this year, our colleagues. Remember Dr. Diaso died August 1st. We've lost some other doctors in some general hospitals that they died in quick successions, and it's our time to celebrate ourselves. And this topic is very, very apt about it's our time to get it right. Now there's a transition of government right now, so we believe that this time is to set policies, formulations, ideas that will bring the transform healthcare space and put the welfare of doctors as paramount now in keeping them and making them stay and not leave the country again. So it's important insurance. Most doctors can't afford the challenge they're going through. The medical conditions are very, very expensive. So I believe with an medical insurance that's specific for medical doctors, in this doctors and healthcare workers, it will support them to stay back in the country. It's more compensatory and also complementary.
Some of us should endeavor to go into politics so that we can interact actively, let them know the correct position of things so that when they want to make decisions, the decisions can be for the benefits of everybody. If the health personnel are there and are telling you that, look, for your economy to be perfect, they say health is wealth. And it is when you are healthy that you can give back and get the best of economy. We know that when you spend so much money for health, it will translate to better activities, and we have a lot of things to get. But if you are not there to educate them, or you are there to sit down with the policymakers to make those things happen, they might come out with some decision which in their view is for the best interest. Meanwhile, it is shortchanging some other areas. Like when they sat and they agreed that 15% should be earmarked to health ministry in the Abuja Declaration of 2001. They had good intention.
If government can improve on the well-being of doctors, for particularly those ones that have stayed behind and have put in a lot of energy to keep the health services, running as properly as it can be, they should get some recognition. And the other thing is that the government must make very serious effort to improve the budget of the health services. What is happening to our people here? The only thing that people see is when there is an accident that affects a big personality. Then they say the health services, the doctors are not efficient. But it's a lot more than that.
The National Agency for Foods, Drugs, Administration and Control, NAFDAC, recently destroyed fake and expired medicine worth 16 billion naira at the Okedia dump site in Shagamu, Ogun State, southwest Nigeria.
Press is one of the our weapon of sensitization. So more sensitization. For instance, this activity now will help us to project it. People will get to know more that there is danger in consuming unwholesome, substandard, expired products, and that we are interested in mopping them out of the society. So with more awareness, nobody will want to consume what is injurious to their health. Many people patronize these products out of ignorance. Some of these products are voluntarily submitted to us. Those that have expired products in their custody, they bring them to us voluntary for future. Some we get them from the market. So we solicit for more collaboration by our sister agencies. Many times, like over 2 billion of this was given to us by customs. So our sister agencies, as they do their bit at the borders, when they see inflow of products that are not registered by NAFDAC, they now come, they now seize them and send them to us.
The products that we're destroying is worth 16 billion naira. You can imagine what that amount of money, if it's properly channeled, will do to the economy of Nigeria. But criminal elements that decide to poison Nigerians and jeopardize the health of Nigerians are wasting this money. And we will not allow them to succeed in that. Because NAFDAC, actually, our responsibility is to protect the health of the nation. And that is what we are doing. And the essence of this exercise, this kind of exercise, is to ensure that these products, which are violated, they are expired, they are falsified, they are fake, they are counterfeit, they are unwholesome products. We want to ensure that they don't get back into circulation.
I work for USAID-funded Breakthrough Action Nigerian project, and I'm asking you to watch Health Affairs because it is an authentic platform for health information.
Welcome back. Community pharmacists are also called chemists. They are experts on how to use medicines. They dispense prescriptions, sell over-the-counter medicines, and can give advice on treatment of minor ailments and certain health conditions. This category of healthcare professionals are very vital in healthcare delivery, especially in rural communities. In the era of quackery and fake medicine in circulation, our aim today is to help you identify true community pharmacists and their scope of operation.
Community pharmacists are the same professionals, are pharmacists we see who run their businesses and practice
in different communities across every state of the Federation. Primarily, we provide pharmaceutical care, pharmaceutical services in these structured offices we operate. Essentially, we stand forth or standing as members of the healthcare profession where we are the most accessible to the communities. And so, in very simple terms, we are available to attend to most of the simple, everyday illnesses that people encounter through our professional interventions. And where we encounter cases that need referral, of course, we have not always failed to do so. In projecting our services beyond the areas of coverage today requires a lot of synergy. Synergy on the part of our bigger society, synergy on the part of our regulatory body, synergy on the part of government, and of course, synergy on the part of the media, which your organization represents. So much can be done if the regulatory framework that protects our practice is guaranteed. The chances are that many more pharmacists will take up interest in retail practice, in community practice, and want to set up in the hinter areas. And so, our regulatory body and government have a crucial role to play in this direction. Government even have much more role to play in the area of guaranteeing security. A number of our communities in certain troubled regions are not serviced, and it's not deliberate. It's because most of those areas are challenged security-wise. And so it might remain so until government is able to find a solution to keeping the environment relatively safe for professionals to move in. And I know this is not peculiar to pharmacists alone. Other professionals are having similar challenge moving into the hinter areas or in troubled zone. But beyond that, for those of you in the media, you have a lot of role to play, which you've been doing by this privilege you've granted me to continually join us on the advocacy trail. The more you speak and give us audience to speak to the public, to carry on advocacy or understanding to the public, the better awareness and information that reaches the grassroots. And so for the members of the public, they should recognize that there are typical signs with which you can recognize an authentic and a genuine retail or community pharmacy where to pick up your medicine. We have the RS emblem or RX logo, displayed conspicuously at the entrance or within the complex where a pharmacist is located. Only registered pharmacists are allowed to carry that emblem. And so when members of the public recognize that there's a certain place or certain places where they can pick genuine drugs, get counseled, get the best of whatever medication they buy, the chances of reducing the influence of quacks begin to reduce. Of course, we know that within our regulatory framework, either as PSN, PCN, or NAFDAC, so much more still needs to do to control access and availability of these drugs from the entry point or from production point or for distribution point. And these are still areas we need to talk to ourselves as professionals to also get our acts right. But by and large, members of the public should trust that pharmacists are always ready and available to be anywhere they ought to be. But the regulatory framework, the conduciveness of the environment must also guarantee our safety. Essentially, the enlightened public understands that what they should seek in a pharmacy is for basic everyday OTCs, over-the-counter medicines, prescription drugs that have duly been prescribed by authorized physicians or doctors, and perhaps a few support-related medications. But we know that quite a number of the less educated, less informed will come to pharmacy, and they do come to pharmacy and other illegal outlets to make requests beyond what is the regulatory control or framework that a community pharmacy can offer. And so all we can do is to continue to partner with those of you in the press to continue this enlightenment program that cases that are beyond what primary health care service can offer should not be sought in a pharmacy. But even at that, as many who come to pharmacy to relate and request these services don't always get them because we don't offer them. No duly registered pharmacist will go beyond the dictates of his or her license. And so it behooves government, again, like I've said, to begin to agree with us that there is need to strengthen regulation. Once that is done, quacks will not be in the system anymore. Yeah, sincerely, I add my voice to appreciate the Minister of Health, Ministry of Health, and the federal government in general with the open hand with which pharmacists are being received. Our advocacy in the direction of vaccination is getting more attention from government, and I know it can only get better. And even we as pharmacists have embraced with open hands the need for us to upscale our skills in this direction. And so many programs, certification programs have been put in place in the last 3 years to engage pharmacists actively in this direction. I can only advise the public, please buy your medicines, buy your drugs from registered pharmacies. Drugs you pick or medicines you pick on the roadside, from those who hawk, from those who sell on the roadside, from quacks, you will recognize that the conditions upon which these drugs are stored are not healthy, are not good. And so most of the things you call drugs are actually already poisons. And that's why you see, to a large extent, we're having increased cases of liver-related problems, kidney-related diseases, as a result of these toxic substances people consume in the name of drugs. So it is safe to pick your medicines from retail and registered pharmacies. The channel to get us, you all know them. Just look around your community, ask questions, and someone will lead you to where a registered, practicing community pharmacist, is situated.
If you're just joining us, it's Health Affair on AIT, and next on the program is a nutrition segment, an aspect of the program that talks about eating right to stay healthy.
It's a common saying that you are what you eat. This is why we make it a point of duty to give you information about food items, fruits, and their nutritional value to help you make healthy choices on our nutrition segment every week.
Examples of fat include palm oil, groundnut oil, coconut oil, olive oil, fish oil, and vegetable oils such as soybean, canola or rapeseed, corn, safflower, and sunflower oils. Vegetable oils can be converted artificially to trans fats, which are usually used for commercial purposes. Fats in general are sources of energy and vitamins, but are harmful to the heart and blood vessels when consumed in excess. Industrially produced trans fat has no nutritional benefit and is more harmful to the heart and blood vessels because it increases the level of bad cholesterol in the blood. It is recommended to eat minimal fat and oil in your diet and to avoid trans fat. Limit your total fat intake by adopting healthy lifestyle, such as steaming or boiling instead of frying when cooking, replacing butter, lard, and ghee with vegetable oils such as soya bean, canola, corn, safflower, and sunflower oil. Limiting the consumption of baked and fried foods and pre-packaged snacks and foods that contains trans fats.
Join us on our clinical segment for tips on healthy living.
Medicines are supposed to act in the way they are prepared. And when you begin to use them with certain things that affect either the active ingredient itself or the formulation itself, then you do not expect that medicine to deliver as it ought to deliver. Medicines are to be taken with water. Okay? They are to be taken with water. If you take medicine with some soft drinks, some cola drinks, mind you, some of those cola drinks contain caffeine. And caffeine in itself is like a medicine, which for some drugs, it either potentiates the effect, that is increasing the effect of that medicine, and some other things can actually affect the ability of that medicine to act. For example, coconut water. Even from the villages, we know that if you use coconut water, within the time you have taken medicine, it chelates the medicine, which means the drug cannot work. Okay? If you use fruit juice, for example, to take some antibiotics, they spoil the antibiotic. The same goes with, putting medicine in food, for example. Yes, we know that maybe ultimately the churning activity of the stomach will release it from the food. But there's what we call disintegration time of medicine. What is that? There is a time period within which the medicine you have taken in your stomach should be disintegrated to release the active ingredient. And the earlier it is done, the more time the body has to assimilate this medicine. Therefore, if you are burying your tablet inside Eba or Pando, and at some point it is not properly released, that means the assimilation will be poor. That means the outcome of that medication will be poor. Therefore, the best way to take your medicines will be with water. Okay? And for some medicines that are recommended either before food, it should be taken before food. For those that are recommended after eating, then you take them after eating, but always with water.
On our perception segment, we appreciate your contributions on how to improve human lives.
The female legislatures are now in their different houses of assembly, and it is now that they should walk the talk, to support legislations that can better the lives of women and children, that can contribute to betterment and development.
This is our wrap it up this week. Thanks for spending your time with us. Let's do it again same time next week. Please endeavor to advertise your health products and services on the program. I remain yours truly, Ushua Mowa Daniels. Please keep staying safe.